المحاضرة الثانية لليوم وهي بخصوص الأونكوجينيك ديزيزز أو ما يسمى بالكانسرز. Tumors are diseases which are characterized by abnormal proliferation of cells. We know the cells of the body has always a normal proliferation. So if there is any abnormal proliferations of cells of any organ, of any cell in the body, this is called a tumor. If they are localized and do not invade the surrounding tissues, they are called benign tumors. But if they invade the surrounding tissues, they are called malignant tumors. So any abnormal proliferation of cells is called tumor, which is either benign if it is localized and do not invade other tissues, or it is malignant, in which they invade the surrounding tissues. What about the tiny trends of tumors all over the world? The incidence of cancer with time is not static. If you know the term incidence, what does it mean? Incidence means the occurrence of new cases in a period of time. So the occurrence of new cases of cancer with time is not static, غير ثابتة. حدوثها في العالم غير ثابتة. But it shows temporal variation in many countries. There are variations. For example, in the United States and Europe, there was striking increase in lung cancer incidence in both sexes, which is mainly attributed to factors like smoking. But now and after the anti-smoking program in these countries, the lung cancer is decreasing. So there are variations both in the United States and Europe. Now there are programs which are against smoking, and because of this program, because the smoking has been decreased, so the lung cancer incidence is reducing now, while previously it was very high in both sexes. Also, there is sharp decline in stomach cancer nowadays, and especially in these countries, due to increased consumption of fresh fruit and vegetables. These factors are protective, which lead to decline in stomach cancer. While in females, the incidence of other tumors remains stationary. There is no change, there is no decline. For example, breast cancer. The incidence of breast cancer remains the same without any change. So that's what we mean, but there are variation in the incidence of cancer, that some cancers decline or reduced due to certain factors, but some of the other tumors or cancers, such as breast cancer, the incidence is the same or stationary. To measure the occurrence of cancer in any defined population, we use certain indices, مؤشرات المرض. So first we have morbidity indices, and we have mortality indices or indicators. Morbidity means مؤشرات المرضى, والmortality means مؤشرات الوفيات. So regarding morbidity incidence, we have incidence rate and prevalence rate. What is the difference between incidence and prevalence? Incidence rate of any disease means the number of persons newly diagnosed So if we mean incidence rate of cancer, of any cancer, this means that a number of persons who are newly diagnosed as cancer per 100,000 population. هذا العدد الثابت ممكن يكون 1000، ممكن يكون 10,000، ممكن 100,000، لكن كل ما كان العدد قليل للمصابين فنضرب الثابت بعدد أكبر فيكون per 100,000 population. While the prevalence rate means it's a measure of existing disease. What is existing means both new cases and previously diagnosed cases, i.e. both new cases and old cases which are still having the disease annually or per year and also per 100,000 population. So the difference between incidence and the prevalence, the incidence are the measure of new cases in 1 year of cases of any cancer, while the prevalence is the measure of cases who are newly diagnosed and who are previously diagnosed and still diseased with this type of cancer. What is the proportional or relative frequency? It means the percentage of a specific type of cancer among all cases of cancers diagnosed during certain period of time. يعني نسبة معينة، يعني نسبة نوع معين من كل الأنواع. Percentage of specific type among cases of cancers, all cancers diagnosed during certain period of time. The other type of indicators or indices are called mortality indices, مؤشرات الوفيات. We have many types. The most important one here in cancer is the case fatality rate, أو تسمى أحيانا case fatality ratio. It is the number of deaths of cancer per 100 cases of cancer. Means number of deaths divided by number of cases of the same cancer multiplied by 100. If it is multiplied by 100, it is called ratio. If it is multiplied by 1,000, it is called rate. The case fatality ratio is important to be calculated. Why? Because it reflects or it indicates the severity of the disease or the fatality of the disease. So if you have a certain number of cases due to certain cancer, how many of these cases will die among these cases? This is called the case fatality ratio. For example, if certain cancer of any organ has a case fatality rate, high case fatality rate, say, for example, 70%, this means among the cases of that cancer, among 100 cases, 70 out of them will die. We have also another indicator which is called cause-specific mortality rate. Cause-specific means according to the cause. This is the number of deaths of cancer due to certain cause or certain type per 100,000 of population. And for example, if we take a breast cancer, so the number of deaths due to breast cancer, اللي هو specific cause, divided by total population multiplied by 100,000. We have another indicator which is called proportional mortality ratio. Proportional mortality ratio, نسبة من الوفيات العامة. It is the percentage of number of deaths from any cancer over the total deaths in a certain locality and year. عندنا مثلا منطقة معينة بيها في سنة محددة عدد وفيات لكل الأسباب. رح ناخذ عدد الوفيات ل certain type of cancer divided by the total number of deaths اللي حصلت في هذه المنطقة multiplied by 100. يعني راح نطلع نسبة قد الوفيات لنوع معين من الكانسر مقارنة أو نسبة إلى العدد الكلي للوفيات في هذه المنطقة. those are certain indicators which are called mortality indicators in cancers. What are the etiology? What is the etiology of cancer? The actual causes of any malignant disease of people of man are not very well known. All we have are the risk factors, which, if these risk factors present among group of individuals, most probably these individuals may have cancer. So as any chronic disease, such as in a previous lecture, when I talk about the cardiovascular diseases, it's chronic disease. Here, cancer is a chronic disease. Usually, there are risk factors for the development of these diseases. The risk factors here for cancers are classified into environmental factors and host factors. The environmental factors بيئية أسباب بيئية include physical, environmental, chemical, and biological. The causes or risk factors that arise from the environment, while the host factors include genetic factors and familial risks. And also there are some certain known benign lesions which, if not treated early, they may turn malignant later. There are some benign lesions. We call them benign. We consider them benign. But if we not treat them very early, if we leave them without treatment, they may turn later on with time into malignant tumors. These lesions are called pre-cancerous lesions. Pre يعني ما قبل التحويل. Pre-cancerous lesions. Example, leukoplakia. These are a lesion in the tongue. Rectal polyps, gastric ulcer, and breast papilloma. These are examples of precancerous lesions. Usually they are considered as a benign lesions, but if they are not treated, they may turn into malignant ones. We are going to talk about the risk factors and the type. First of all, the host risk factors. 70% of the cancer risk factors are related to human behavior, such as type of food we usually eat, smoking, alcohol consumption. These risks actually are preventable, or what we call modifiable. So the behavioral risk factors of people, such as type of food we eat, smoking, alcohol, they are preventable or modifiable risk factors. While other host risk factors, such as gender and age, are non-modifiable host risk factors. These are related to the people, and 70% of them are related to the behavior of the people. Other risk factors which are related to the environment, we call them environmental risk factors. They are classified into physical, chemical, and biological factors. هي عوامل بيئية نتعرض لها من ضمن البيئة، ممكن تكون عوامل فيزيائية، كيميائية أو بيولوجية. Among the physical factors, the main one is the radiation, إشعاع. So exposure to radiation is one of the important risk factor of cancer. If any person exposed to radiation, This is considered as an important risk factor of developing cancer. Actually, it occurs either as occupational exposure during occupation or non-occupational exposure. The occupational exposure means when somebody has a work in which he is exposed to radiation. For example, health workers, doctors who work in X-ray, they may expose to some X-ray. Any other job in which there is radiation, this is سميها occupational exposure. While the non-occupational exposure radiation, examples for that, accidental exposure due to atomic explosions انفجارات راح يصير accidental exposure للبيئة. Another example, leaking radiation from nuclear energy station محطات الطاقة النووية ممكن تسبب leaking radiation للبيئة المحيطة. And also there is indirect exposure through imported contaminated food from involved areas, from areas who have radiation. The radiation will be in the food, يعني راح يكون contaminated food with radiation, or sometimes there is what is called the rain of radiation carrying clouds. وبعض الغيوم who carry radiation فراح يكون المطر من عندها أو الرين may have some radiation. فهذه نسميها accidental أو نسميها non-occupational exposure to radiation. The effect of this crisis, which is the exposure to radiation, appear usually after many years, but again according to the dose of radiation and according to the duration of exposure. According to the dose and the duration of exposure. يعني التعرض للراديشن ما يطلع بشكل سريع وإنما ياخذ سنين طويلة حتى تطلع الإيفكت. وأيضا الإيفكت تكون تعتمد على الدوز of exposure، تعتمد على the duration of exposure. Another reason or cause of exposure to radiation are those cases who are treated with radiotherapy. They are also considered at risk. Also, exposure to ultraviolet rays of the sun for a long period of time may predispose to skin cancer, and especially after ozone depletion in the atmosphere. فلما اكو ثقب بالاوزون راح يكون الالترافايلت ريز راح تكون قويه، فراح يكون الاكسبوجر الى هاي الالترافايلت ريز لمده طويله it may predispose to skin cancer. Aircraft crew طاقم طيارات، nuclear plant workers اللي يشتغلون في المصانع النوويه، medical and non-medical personnel, medical and paramedical personnel are also at risk لأنهم ممكن يتعرضون إلى radiation. Health workers. So, one of the most important physical factors is radiation, as we mentioned. Now we'll talk about chemical factors. The carcinogenicity of chemicals may be due to many factors. Some chemicals have carcinogenicity, but it may be due to what? It could be due to its chemical nature or its metabolite products. Sometimes the chemicals themselves are not carcinogenic, but they acquire the carcinogenicity through metabolites which are produced by enzymatic actions. يعني chemical substance نفسها هي not carcinogenic، لكن إذا أكو إنزيم أكشن عليها ويظهر منها ميتابولايتس. هذه الميتابولايتس الناتجة منها قد تكون هي كارسينوجينيك. مو هي نفسها، مو الكيميكال سبستانس نفسها، لكن الميتابولايتس بسبب الانزيماتيك اكشن قد تكون كارسينوجينيك. Third factor, synergistic role. What does that mean? A particular chemical may be only carcinogenic when some other chemicals combine with it. Synergy with other chemical substance means certain chemical substance is not carcinogenic, but if it combines with another chemical, it will turn as carcinogenic. Another reason is pathological carcinogenic effect. Sometimes the chemical produce pathological condition which predispose to cancer. It's not the same chemical substance, it is not carcinogenic, but because it results in some pathological condition or in some disease, this pathological condition will cause cancer. For example, alcohol as a chemical substance itself may cause liver cirrhosis. And this condition, this pathological condition, liver cirrhosis, predispose to hepatoma or carcinoma of the liver. So these are the explanation of the carcinogenicity of the chemicals, either the chemical itself or its metabolite, or when it combines with another chemical, or because of its pathological effect will turn or predispose to certain cancers. I'm going to give some examples of chemical carcinogens, some important chemical carcinogens. First, tobacco. The cigarette, the cigar, the pipe, shisha, and chewable tobacco all cause cancers. They may cause about 15 types of cancers. Second, hormones, either exogenous hormones or endogenous. Exogenous means if we take hormones from outside the body. For example, synthetic estrogen or androgen hormones, they are potentially carcinogenic to liver. Synthetic estrogen and androgen hormones, they are potentially carcinogenic to liver. Endogenous hormones means the hormones from inside the body. For example, when there is endocrine disorders such as high prolactin hormone, this may be associated with breast cancer. So exposure to hormones, whether it is exogenous exposure or endogenous due to certain disorders, this may be or may lead to cancers. Another chemical cancer are dietary chemicals. Examples of dietary chemicals or chemicals from food: aflatoxin. Aflatoxin is a chemical product of certain fungi. أنواع من الفطريات تطلق aflatoxin, which grows in food like peanuts and grains. ممكن يطلع الافلاتوكسين بيها. Aflatoxin proved to produce liver cancer in experimental animals. إذا بالتجارب شافوا بأنه أكو احتمال يسبب الليفر كانسر، وهو يطلع ببعض أنواع الفود مثل البينات والجرين اللي تنتج بعض الفنجاي اللي موجودة بيها. Another dietary chemical is the artificial sweeteners. High doses of artificial sweeteners may increase the risk of bladder cancer. These are all studies, but it may lead to increased risk of the bladder cancers. food additives، هذه الأصباغ والملونات في الطعام. All they are risky and may cause some cancers. The nitrates which are present in the preserved meat and fish. عادة المعلبات يخلونها مادة النيتريت حتى تبقى صالحة لفترة معينة. So this nitrate, which is preserved mainly in meat and fish, or which are formed from dietary nitrates due to bacterial action, which change to N-nitrose. Nitrate change to N-nitrose. These are carcinogenic compounds to stomach, colon, and esophagus. So the nitrate, either which is in the preserved meat and fish, or which are formed from dietary nitrates due to the effect of bacterial action and change to N-nitrose, will cause cancer of stomach, colon, or esophagus. Also, other type of dietary chemicals, the carcinogenic polycystic aromatic hydrocarbons, which are present in smoked food as well as charcoal grilled meat. إذا هذه الميت اللي يكون grilled بالفحم أو بالسموكed food تتكون polycystic aromatic hydrocarbons وتكون carcinogenic. هذه كلها بالفود أو نسميها dietary chemicals. 4 we have air pollutants. بالهواء بالair أكو chemicals ممكن تكون carcinogenic. So chemical produced from exhaust products of a fuel consumption of vehicles or from industrial pollution by fumes, vapors, or dust of different chemical substances such as asbestos, nickel, lead, manganese, chromat, and cadmium. هذه معناها إنه any chemical اللي تطلع من بعض الأبخرة مثل الإكزوست اللي يطلع من أوادم السيارات، من الفيهيكلز أي نواقل، أو من بعض المعامل اللي يصير الأبخرة اللي تطلع أو الدست اللي يطلع ويسبب pollution ويطلع بسبب بعض المواد الكيميائية مثل الأسبستوس أو النيكل أو الليد الرصاص أو المنغنيز أو الكرومات أو الكادميوم. هذه الأبخرة اللي تطلع من عندها وتبقى بالأتموسفير وتسبب pollution ممكن تكون carcinogens. فإذا some of the air pollutants are carcinogens. إذا ذكرنا أنه بعض important chemical carcinogens قد تكون tobacco، قد تكون hormones، قد تكون dietary chemicals، أو قد تكون certain type of air pollutants. هذه chemical. واللي قبلها physical ذكرنا radiation. Now biological factors that may cause cancers. Examples: viral infection. We have certain viral infections which may cause cancer. For example, herpes simplex virus that affect the genital tract. It is usually associated with cancer of cervix. Virus B and C hepatitis or hepatitis B and C predisposed to liver cancer. Another example is the HIV is blamed as etiological factor of Kaposi sarcoma. So there are certain viruses which are blamed to be associated with cancers, such as herpes simplex virus of genital tract اللي يسبب CA cervix, hepatitis B and C ممكن يسبب liver cancer, HIV ممكن يسبب Kaposi sarcoma. Other biological factors are parasites such as schistosome, for bilharziosis, which is associated with bladder cancer. So we talked about the risk factors, which are either host risk factors or environment. Now we are concerned mainly with the prevention and control of cancers. Again, we will take levels of prevention. The most important is the primordial and the primary prevention, and this is by controlling the modifiable risk factors, preventing the emergence of risk factors, and control these modifiable risk factors, such as cessation of smoking, or even in discouraging smoking from childhood is important as a primordial prevention. And for primary prevention is to quit, to stop, or to cessation of smoking and applying anti-smoking programs. Second, good dietary habit is very important, and encourage the take of fresh fruit and vegetables, and good food. The third is control of alcohol consumption is very important. Fourth, protection of workers from occupational hazards. protection of workers، حماية كل العاملين اللي يشتغلون في أماكن معينة يكونون معرضين إلى الكارسينوجينز which may lead to cancers. يعني protection them such as from radiation, protecting them from certain chemical substances, protecting them from biological hazards also. So these are all primary prevention. Fifth, also immunization. This is also step to prevent certain type of carcinoma such as hepatocellular carcinoma. فإذا immunization اللي هو against B hepatitis, hepatitis B vaccine to prevent hepatocellular carcinoma. Six, maintaining standard for food, drugs, cosmetics. Maintaining standards for these, for food, drugs, and cosmetics. Testing and monitoring always for carcinogens for them. Seven, personal hygiene is very important to prevent cancer such as the cancer of the cervix. Personal hygiene is important in cases of CA cervix. Control of air pollution to prevent the chemicals in air. Bilharzia control program is important to prevent or to control CA bladder. 10th, avoid genetic and familial predisposition to cancer by premarital examinations and counseling, and avoiding consanguous marriage. شو معنى هذه الفقرة؟ Try to avoid, try to lower the risk of genetic and familial predisposition. إذا نتوقع أنه بعض العوائل عندهم familial predisposition to certain cancer, we need to do premarital examinations اللي هي الفحوصات ما قبل الزواج. Take history and certain examinations, certain investigations to know if any partner have certain familial or genetic predisposition to cancer. Counseling, الإرشاد, is very important. And avoid consanguineous marriage. Consanguineous marriage يعني معناها زواج الأقارب. Try to avoid it so that we will reduce this genetic or familial predisposition to cancer. 11, cancer education, which is very important aspect in primary prevention. We need to educate the people how to avoid the predisposing factors which lead to cancer. People are educated regarding early symptoms of cancer so that the detection and the treatment, which is vital, may be started earlier. قلنا education for cancer is important. Why important? Because we can educate them about early symptoms, الأعراض الأولية حتى يعرفوها. وإذا عرفوا الأعراض الأولية بهذه الحالة راح يكون early detection، راح يكون early treatment، فنمنع المستويات المتقدمة من الكانسر. Also, education regarding self-examination of the breast is important. وهذه طبعا education يتم عن طريق المدارس، عن طريق الميديا، يعلموهم how to do self-examination of breast. And also proper screening for at-risk group is very essential. إذا توقعنا أنه أكو بعض الريسك جروبس موجودين بالمجتمع فإذا نسوي لهم screening. Breastfeeding should be encouraged. One of the protective factors against CA breast is breastfeeding. Breastfeeding should be encouraged. Well, self-examination of breast is important. Well, proper screening by mammograph and other screening tests is very important. This is all about primary prevention. Second is the secondary prevention of cancer. We always say that secondary prevention includes early diagnosis and early treatment. Here in secondary prevention of cancer, we mean early case detection is very important. Case registration is important, and then early treatment. For early case detection, this should be done through screening of high-risk people, mass strategy and high-risk strategy. يعني لما نعمل screening أو التقصي عن بدايات المرض، أما أن نستعملها عن طريق الماس strategy for all population، أو أن نطبقها على الهاي ريسك people، نسميها هاي ريسك، استراتيجية الهاي ريسك، يعني ناخذ فقط الهاي ريسك people ونسوي لهم screening. Cancers which are amenable to screening اللي تفيدنا في حالة السكرينينج ونحتاج إلى early diagnosis حتى نوقفها، تشمل cervical cancers, breast cancers, oral cancers, lung cancers and prostate cancers. فإذا من خلال السكرينينج نقدر أن نتوصل إلى early case detection، وبالتالي نقدر أن نبدأ التريتمنت very early ونوقف استمرارية الديزيز أو الكانسر. Second, cancer registration of cases and deaths، تسجيل الحالات which is of two types, either hospital based طريق المستشفى or population based. And then early treatment which adopt multi-modality approach، يعني عدة وسائل، استخدام عدة وسائل which may include surgery or radiation or chemotherapy or maybe combination of any two of these. So early diagnosis by early detection of cases, early treatment by using multimodality approach is very important to stop the progress of the cancers of the diseases. The third type of prevention, which is called the tertiary prevention of cancer, this is beyond the durable stage pain and palliative care, which assumes the importance. I mean by that, if the cancer still it reaches the stage in which there is metastasis or spread in the body and there is pain, so we use certain steps to relieve this pain through palliative care. Also rehabilitation أو التأهيل by finding a proper job for patients, by group psychotherapy العلاج النفسي or psychosocial support service is very important. ممكن يكون الدعم الاجتماعي والنفسي for those patients. هذا يعتبر في جزء من التأهيل، يساعدهم أيضا في ال prevention أو في عملية التغلب أيضا عن المرض. I will stop here for the second lecture, and maybe for the next weeks we will continue the oncogenic diseases. We have another 2 lectures about the certain types of cancers. And thank you very much for listening, and if you have any questions, we are ready for that. Thank you very much. مع السلامة.